Thank you. Good afternoon. Although he isn't here with us in person, I'd like to start by thanking Dr. Drucker for being here with us today. You see, as a cancer survivor, it's because of him that I'm able to stand here today. For me, the year was 2001 when I got my cancer diagnosis, but my story with the American Cancer Society goes back almost 3 decades, to the mid-'70s, when I was one afternoon preparing dinner for my family of 4, when that 1970-80s yellow wall phone, princess style, hanging, remember those? It rang. Probably solicitor, it is the dinner hour, but I answered it anyway. It was my neighbor, Gary Ewing. He asked me if I would help coordinate the Gwinnett County Neighborhood Crusade. It was a phone call that changed my life and quite possibly saved my life, but I'm getting ahead of myself. As a young mother after that call, I began volunteering for the Society's Education Funds Crusade, where we went door to door in the neighborhood, giving out literature about the 7 warning signs of cancer and asking for donations. And then I went on to work in different areas of education and part of the mission. I drove cancer patients, a very rewarding job, to their rides, those who didn't have treatments. I didn't know anyone who had cancer back then, but unfortunately that was to change very soon. In the early 80s, the American Cancer Society fundraising changed from the neighborhood crusade to special events. And it was galas, golf, tennis, things we still do, swim for a cure, and events like jail and bail. Our county was so sick of jail and bail that there were a list of people we could not contact. We needed to do something, but what? Thank goodness we heard about this new event, Relay for Life, where you walked around the track for 24 hours, honored survivors, celebrated their lives, and people from all over the community joined in. I bought it, lock, stock, and barrel. Our executive director, different organization back then, she wasn't so sure about it, but the volunteers, we knew it would work. We involved people who had connections all over the county, the second largest county in Georgia, by the way, and I had the amazing opportunity to chair this event for 4 years. Thanks to a continuation of dedicated volunteers, a school system where nearly every school of well over 100 participates, along with groups like bus drivers, and you just wouldn't believe they're all there. The Gwinnett County event grew too and remains today the largest relay for event in the world. Yeah. Whoa. With Gwinnett's success, I was asked to go do trainings around the country. And I may have trained some of you way back then. Training was a little different then. I was asked to join the brand new nationwide Relay for Life advisory team with the brand new Relay for Life business unit that Dr. Sefrin talked about yesterday. It consisted of only 3 staff people, Rule Johnson, Olivia Gertz, and Terry King. And I worked with them and chaired that incredible advisory team for 3 years. Group of volunteers with people like Pat Flynn, the mother of Relay that you've heard from this week, Terry Zahn, the voice of Relay, who lost his cancer battle, and Dr. Bob Brodell, Mr. Celebration on the Hill. Worked with them for 3 years until the year 2000. I love Relay for Life for the people, for the fun and the experience. But for me, like all the fundraising I've done for the past nearly 40 years, it's always been about funding the mission. Why, you might ask? Well, if you could look in my medicine cabinet, you'd probably figure it out. I mentioned earlier that I'm a cancer survivor, and it's because of Dr. Drucker that I'm here. You see, I live with chronic myeloid leukemia and have been taking Gleevec for the past 13 years, very successfully, I might add. I've been taking the drug that Dr. Drucker, thank you. Thank you. I've been taking the drug that Dr. Drucker developed, and as he said, he started his research with a grant from the American Cancer Society. And even more, it was the American Cancer Society funded researchers back in the 60s and the 70s who made discoveries that gave Dr. Drucker the baseline knowledge he needed to develop the drug. Now, Otis might say that differently than I do, but that's my brain here with my layman's terms. So you see why I say that because of the funds raised by the American Cancer Society through the Neighborhood Crusade back in the 60s, through all the events we did in the 70s and 80s, but especially for the last 30 years with Relay for Life, you've raised funds that help people like Dr. Drucker. Those funds were raised by all of you in this room, and because of that, again, I'm able to stand here in this room. Relay for Life has saved my life, and it allows me to fight back in ways I never would dream possible, especially after being diagnosed with a deadly blood disease that was fatal for almost all people. Gleevec, as you may have heard, is a targeted drug, and as such, it allows you to have a very good lifestyle, a great quality of life, because it doesn't go to the other cells in your body and make you sick. It fights and practically eliminates CML, but it gives a patient a wonderful quality of life. And because of that, I'm an active ACS-CAN volunteer, sharing my voice and story with lawmakers, advocating for more dollars for research, which will save more lives. I believe that with all my heart. Yay, ACS-CAN! I'm an active fundraiser and still participate in the Gwinnett Relay for Life as a caregiver, as a survivor, and in the Habersham County Relay, where I live now, as a committee member, survivor, caregiver, and team captain. And I've had the honor of being the Global Relay for Life lead volunteer, which gave me the opportunity to go to countries like Ireland and Portugal and Australia to help take the gift of Relay for Life to those populations. And in those countries where cancer diagnosis is a social stigma and people lose their jobs, as you will hear in a few minutes, what a gift Relay for Life has been. The bottom line, I'm one of the lucky ones. Thanks to the research we funded, I'm able to enjoy my grandchildren, Taylor. Taylor and I were on the cover of the American Cancer Society annual report a few years ago. And my daughter was pregnant with him when I was diagnosed. I've been able to enjoy our granddaughter, Cecilia, and my husband, our dog, McGregor. The other picture was taken at our mountain home in Georgia. We call it the mountains. It's really the foothills, but you know, they're mountains to us. So I enjoy life with my husband, Dick, who, by the way, is an 8-year survivor of prostate and bladder cancer. But unfortunately, the truth is there's not a Gleevec for everyone. And although we're saving more lives than ever before, we still all know and have loved ones who have lost their battle, and we've lost them too soon. In January, my husband and I lost one of our dearest and closest friends, less than 2 months after he was diagnosed with pancreatic cancer. So we need more Gleevecs. Fundraising isn't all that we do, but all that we do in the lives of so many depend on it. My name is Phylecia Wilson. I began relaying in 1993. I'm a cancer survivor, a caregiver, a Relay for Life Hall of Fame member, and I'm proud to say that Relay for Life is 30 years strong. Thank you.